Hello, this is Stephanie Joseph with Indiana State University, Nursing 444, Community Health Nursing, with a Health Education Project number 3. We're going to go over total knee arthroplasty, also known as the knee replacement. Alright, let's get started with a small pretest to test your general knowledge and to see where you are in the understanding of a total knee arthroplasty. 1. What is a total knee arthroplasty? Why would someone need a total knee arthroplasty? What is used to replace the knee? What are the different types of knee replacement surgery? And what are the complications that can happen with a total knee arthroplasty, also known as a TKA? If you can answer majority of these questions, you pretty much have a good foundation about total knee replacements. But for those of you who don't, continue to watch and gain some understanding and knowledge all about a total knee arthroplasty. The learning objectives for this presentation will be: the learner will be able to define what a total knee replacement is. The learner will describe why someone would need to have a total knee replacement. The learner will be able to explain what is used for a total knee replacement, as well as describe the different types of knee replacement surgeries. The learner will be able to describe the complications that can happen with the types of knee replacements as well. Total knee arthroplasty, also called total knee replacement, and can be abbreviated as TKA. Commonly referred to as a knee replacement surgery, this surgery replaces the worn knee joint with a prosthetic implant. It is primarily done to relieve chronic pain or instability. The joint replacement implants are designed to smoothly function to prevent pain from bone-on-bone contact. Other than pain, there are also some other indications for a total knee replacement. The main is osteoarthritis, which is a major indicator for a knee replacement surgery. There are two different types. Type 1 is primary and is associated with the genetic abnormalities of the knee. Type 2 is a secondary condition, which is usually related to a history of trauma. Most people see type 2 as a secondary condition related to sports injuries, accidents, of things of that nature. So let's talk about the actual replacing of the knee. The knee itself is replaced with the implant. The implants are made of titanium and durable plastic. There are 3 pieces to this implant. One is on the femur, the other on the tibia, and lastly one on the patella, which is the resurfaced with nylon polymer button to prevent the bone from sliding on the femur implant when the knee is flexed. The femoral and tibial pieces are then cemented in place. As you can see to the diagram, it looks just as smooth as a joint, but you just have metal inserted into the bones. Sometimes people opt to have a partial knee replacement instead of a total knee replacement. Some people have a small portion of arthritis in their knee, and so will only need to have a unicompartmental or a partial knee replacement. This procedure replaces just one side of the knee joint. Osteoarthritis usually occurs on the medial side of the knee first because this side bears more weight. The unicompartmental approach leaves the outer compartment and ligaments intact, which may help the joint to function more naturally. Okay, so now let's review some pre-op qualifications and expectations that will happen during signing up and getting ready for a total knee replacement. You would get educated on what to expect before, during, and after surgery. They would want you to have a BMI less than 40, a hemoglobin A1C less than 7.5, to stop smoking, and to have a vitamin D greater than 30. There are a few other requirements, such as making sure your dental status is up to date, you're cleared by various PCP, pulmonary, oncology, hematology, cardiology, if need be. And if you're on anticoagulants, they will want you to see the anticoagulation clinic to make sure they have clearance for all parts of the surgery. Okay, so now on to what happens during post-op. You will usually have a hospital stay that's around about 1 to 2 days, and the patient will usually start walking the day after surgery, if not the night after surgery. The staples will be removed 10 to 14 days post-op. You'll have physical therapy that starts typically when you're in the hospital recovering from the surgery. Patients will receive 2 weeks of in-home therapy, then will transition to outpatient therapy. Therapy usually lasts for 3 to 4 months. Most people can resume their regular daily activities in 3 to 6 weeks and start driving in 4 to 6 weeks after surgery. It can take 4 to 12 months after surgery for a fully recovered knee replacement. Patients who have knee replacement surgery are usually given a cold compression machine that serves as the ice pack, as well as a machine that will help stretch and do range of motion activities to aid them in the recovery after surgery. The goals and outcomes for a total knee replacement is usually excellent. This surgery relieves pain for most people, and once they are fully recovered, they usually do not need help walking from assisted devices that they once used, such as a walker or a cane. Artificial knee joints can last 10 to 15 years, and in some cases, they can last up to 20. High impact exercise after a knee replacement is not recommended, as this can wear out the artificial joint faster. Now, although the goals and outcomes of a total knee replacement are phenomenal, there are some complications that can arise from a total knee replacement. Infection can occur with any surgery. If a patient develops an infection after a total knee replacement, a surgical incision and drainage, which is an IND, is done to wash out the joint, and they are placed on IV antibiotics via a PICC line that is placed in their arm. There is also loosening of the prosthetic can sometimes happen and can sometimes occur in patients if they are doing too much too fast or too hard on their knees after surgery, or if the cement holding the implant in place is wearing away. This is often manifested as pain after the surgery, and the patient will have to have a revision of the knee replacement to correct the problem. Most times the revision is not as good as the original. There is also a possibility of blood clots. Blood clots are also a risk with any surgery. Many patients are put on a low-dose aspirin after surgery to prevent those blood clots. Neurovascular injury is also a possible complication that can sometimes happen. Some patients may have permanent damage to the nerves and or blood vessels around the knee after surgery. Even though there are complications, there are still great outcomes when it comes to a total knee replacement. All right. You have learned so much about total knee arthroplasty and gained a basic fundamental knowledge about total knee replacements. So let's try this post test to see how well you were paying attention on the previous slides. 1. What is a total knee arthroplasty? 2. Why would someone need to have a total knee arthroplasty? 3. What is used to replace the knee? 4. What is the different type of total knee replacement surgery? And 5. What are some of the complications that can happen with a TKA, which is also a total knee arthroplasty? With these few questions, you should be able to answer them with no problems based upon the information you were provided in the previous slides. Let's see how good you got. All right. You now have great information about total knee arthroplasty. There are many of us walking around today with aches and pains here or there, and I'm sure each and every one of you may have had some question either about yourself or someone that you know that has knee pain and were wondering what the ins and outs were of a total knee replacement. You have the knowledge and the basic understanding to gather and talk to your PCP and to see an orthopedic surgeon in regards to that knee or leg issue that you're having. If you have any other questions, please check out some of the references on the reference page and some of the links that can hopefully lead you to more information. If not, you can always talk to your primary care provider.